Hello. Good morning, all of you. I am nursing in charge in National Hospital, Sri Lanka, in Surgical Unit Ward 29. My consultant is Dr. Amrubanagala. Now I am going to teach you about what is the wound and how to dress the wound. I know as second year nursing students, you all have knowledge about what is the wound, how to dress the wound. I will teach this lesson for you, increase your knowledge about that topic. By the end of lesson, you will be able to, by participants, you will be able to define wounds, classification of the wound, types of the wounds, influencing factors of the wound healing process, complication of the wound healing, wound dressing process. What are wounds? Break in skin or mucous membrane. Injury to any of the tissues of the body, especially that caused by physical means and with interruption of continually in defined as a wound. Classification of wounds. Intentional and unintentional. Open and closed. Degree of contamination. Depth of the wounds. Intentional and unintentional wounds. Intentional wound occur during therapy. For example, operation or venipuncture. Unintentional wound occur accidentally. Example, fracture in arm in Ford traffic accident. Open and closed wounds. Open wound, the mucous membrane or skin surface is broken. Closed wound, the tissue are traumatized without a break in the skin. Degree of contamination. Contaminated wounds include open, fresh, accidental wounds. There is evidence of inflammation. Dirty of infected wounds includes all accidental wounds contaminating dead tissue and evidence of infection such as pus drainage. Depth of the wound. Partial thickness. The wound involves dermis and epidermis. Full thickness involving the dermis, epidermis, subcutaneous tissues and possibly muscle and bone. Types of wound. Incision, contusion, abrasion, puncture, laceration, and stab wound. Incision, open wound painful, deep or shallow due to sharp instrument. Contusion, closed wound. The skin appears ecchymotic because of damaged blood vessels due to blow from blunt instrument. Abrasion, open wound involving skin only, painful due to surface scrub. Puncture, open wound, penetrating of the skin and often the underlying tissues by a sharp instrument. Laceration, open wounds edges are often jagged, tissues torn apart, often from accidents. Stab wound, open wound, penetration of the skin and the underlying tissues, usually unintentional. Factors influence wound healing. Age, nutrition, protein and vitamin C intake. Obesity decreased blood flow and increased risk of infection. Tissues contamination. Pathogens compete with cells for oxygen and nutrition. Hemorrhage, infection, current discharge. Dehiscence, skin and tissue separate. Evisceration, protrusion of visceral organs. Fistula, abnormal passage through two organs or to outside of body. Complications of wound healing. Hemorrhage, some escape of blood from a wound is normal, but persistent bleeding is abnormal. Hematoma, localized collection of blood underneath the skin and may appear as a reddish blue swelling. Infection, Wound healing. Stages of wound healing. Bleeding, inflammatory response, proliferative phase, remodeling. Bleeding phase. Bleeding is the process of wound being closed by the clothing. Inflammatory response. Serum and red blood cells from fibrin network. Increases blood flow with scab forming in 3 to 5 days. Proliferative phase 3 and 24 days. Granulations tissues fills wound. Presurfacing of epithelialization. Remodeling more than 1 year. Collagen scar recontinues and increase in strength. Fever melanocytes pigment lighter color. There is 4 stages of wound healing. Now I show you this 4 stages. First one is bleeding. There will be clot formation. But is on the site of wound, the wound due to bleeding following clot formation. Red blood cells and fibrin network with serum will for a sob. Second one, inflammation. There will be inflammatory process will have place at the site, which kind glow below cells, especially the microphages to the side. Third one is proliferation. Closed cells is there. There is closed cells secrete growth factors which are essential for wound healing. Final remodeling. There will be new issues formation. I think you can understand that all features. Wound dressing procedure. Tie the mask. Reason: to prevent wound contamination with droplets. Second one, hand wash thoroughly. Reason: to prevent cross infection. Third one, put on gloves extra and necessary. Reason: to ensure asepsis. There is a wound dressing. I show you. Fourth one, open the sterile tray. Spread the sterile towel around the wound. Purpose: to create a sterile field around the wound. Fifth one, pick up a dissecting forceps and remove the dressing and put it in the paper bag. Discard the dissecting forceps in the ball lotion. Purpose: to prevent contamination of the hands with the soiled dressing. If the dressing is adherent to the wound, pour normal saline and wet it before removal. Note the type and the amount of drainage present. 7. Ask the assistant to pour a small amount of cleaning solution into the bowl. Purpose: to prevent contaminating the hands of the nurse by the outside of the bottle. 8. Clean the wound from the center to periphery. Discard in the used soaps after each stroke. Purpose: cleaning should be done from the cleanest area to the less clean area. Wound line is considered cleaner than the surrounding area even if the wound is infected. 9. After thoroughly cleaning of the wound, dry the wound with dry soaps using the same precautions. Discard the forceps in the bowl of lotion. Reason: to keep the wound as dry as possible. 10. Apply medications if ordered. Reason: to apply the ointment directly to the wound may be difficult. Apply a small portion on the resin that goes directly over the wound. 11. Apply the sterile dressings. Apply the gauze pieces first and then the cotton pads. Reinforce the dressings on the dependent parts whatever the drainage may collect. Reason: cotton placed directly onto the wound may stick on the wound. When the discharge dries, Hand force in the resin will prevent oozing of the drainage onto the bed of patient. 12. Remove the gloves and discard it to the bowl with lotion. Reason. Gloves worn during the resin will be highly contaminated. 13. Secure the resin with bandage or adhesive tapes. Now, I will ask you any question. Do you understand the lesson? You can ask me any question. Now, I ask you a question. First one, define the wound. Second one, what are the classification of the wounds? Third one, what factors for the wound healing? Fourth one, what is the wound healing process? Now you can ask any question for me. These are my references, dear students. Okay, thank you very much for listening to my lesson.